Ozempic, Semaglutide, and Wegovy, Semaglutide, are one-ingredient pair. Mounjaro, Tirzepatide, and Zepbound, Tirzepatide, are another. The useful shortcut before you compare them is not four different drug families, even though the names sound unrelated. It is two ingredients wearing four brand names. The brand usually tells you the medical lane: diabetes, weight management, or sleep apnea with obesity. That sounds simple, but it changes the first conversation. Active ingredient means the chemical doing the work inside the body. Brand name means the marketed product name. Two people may use the same ingredient for different medical goals. The first pair mainly activates GLP-1, a gut hormone signal that helps appetite and blood sugar. The second pair activates that signal, and GIP, another gut hormone signal. The second pair adds a second signal, so response, dosing, and side effects may not match the first pair. The goal may look similar, but the medicines are not automatically interchangeable. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. Ozempic is the diabetes lane in the first pair. It is used for type 2 diabetes, where the body uses insulin poorly. Insulin is the hormone that moves sugar from blood into cells. Weight loss may happen, but the label starts with blood sugar. Wegovy is the weight management lane in the first pair. Weight management means long-term treatment for obesity or overweight with related problems. It may also matter when heart disease risk is part of the visit. Mounjaro is the diabetes lane in the second pair. It is used to improve blood sugar in type 2 diabetes. Zepbound is the weight management lane in that pair. It is also used for moderate to severe obstructive sleep apnea in adults with obesity. Obstructive sleep apnea means breathing repeatedly blocks during sleep. That condition can raise health risk and worsen daytime fatigue. That is why Zepbound is not just a rebranded diet idea. In the right patient, the name can point toward weight, sleep, or both. Patients often get trapped when the brand name sounds like the diagnosis. A person may say, "I am on Ozempic," but the real goal may be weight loss. Another person may ask for Wegovy, while the untreated problem is diabetes. The brand name alone is not the diagnosis or the treatment plan. The confusion can also appear when the use sits outside a specific approval. Off-label means a clinician uses a medicine outside that specific approved label. It is not automatically wrong. It does mean the reason, evidence, alternatives, cost, and follow-up plan should be clear. For example, someone may receive Ozempic mainly for weight, someone else may use Mounjaro for diabetes, and lose weight at the same time. Those are not identical stories. The treated problem matters more than the most popular name. A familiar brand can make the wrong goal feel correct. For blood sugar, the scale is not the only result. For weight, a lower A1C may look helpful, but it is not the whole plan. That blood test estimates average blood sugar. That makes which one is better the wrong frame. Better for diabetes, weight, sleep apnea, cost, side effects, or coverage. The same name can fit one person and fail another. The real danger is not choosing the weaker name. It is treating the wrong problem with confidence. That confidence can lead to a concrete failure. A patient may lose weight, yet leave diabetes undertreated. Another may hit side effects early and stop before the real goal is measured. Dosing is where that shortcut can become unsafe. The right brand can still be wrong at the wrong dose. Dose means the amount used. If the dose is too aggressive, the treatment may become harder to continue. Titration means slowly increasing the dose so the body can adapt. Tolerance means how well someone handles nausea, constipation, reflux, or stomach heaviness. These are not small details. They often decide whether a patient can stay on treatment. The word stronger can mislead too. A higher dose may produce more effect, but also more side effects. A lower tolerated dose may beat a higher dose that someone cannot continue safely. When switching between brand names or approved uses, do not assume the same dose step applies. The clinician may need to restart lower, pause longer, or adjust the schedule. Some patients never get a second clean chance after a bad start. Cost can make that bad start worse. If supply is uncertain, Ask before stretching doses, skipping weeks, or restarting after gaps. Those choices can change side effects and results. A safer plan is written before the supply problem appears. Brand confusion, dose errors, and supply gaps often arrive at the same place, the stomach. These drugs can slow how fast your stomach empties. This can help fullness, but it can also cause nausea, reflux, constipation, vomiting, dehydration, or low protein intake. Warning signs should be plain. Severe belly pain, repeated vomiting, dehydration, fainting, confusion from low blood sugar, or symptoms after a dose increase deserve medical advice. The exact risk depends on the person, dose, and other medicines. The practical decision starts with 5 items: ingredient, goal, dose plan, risk profile, and follow-up. Risk profile means personal factors that raise side effect risk. Follow-up means the checks used to decide whether treatment is working safely. The action step is concrete. Ask your clinician to write the active ingredient, treatment goal, starting dose, next dose step, and warning signs. If those 5 points are unclear, the brand name is doing too much work. Also, ask how success will be measured. For diabetes, success may include A1C and fewer high blood sugar patterns. For weight treatment, success may include waist size, function, side effects, and nutrition. For sleep apnea, success may include breathing symptoms and sleep quality. Even with a clear plan, response still differs by person. One patient may lose appetite quickly, while another mainly sees blood sugar improve. That is not a branding failure. It comes from body response, starting condition, food intake, and side effect tolerance. The plan may need adjustment after the first few weeks. After body response, payment becomes the next practical split. Insurance may treat Ozempic and Mounjaro as diabetes medicines. It may treat Wegovy and Zepbound as weight medicines. The active ingredient can be shared, while insurance approval differs. Prior authorization is insurance paperwork that asks whether a drug fits a covered reason. A diagnosis code is the billing label attached to that reason. A diabetes code, weight code, or sleep apnea code may send the prescription through a different approval path. After approval, pharmacy records can still create mistakes. A shared ingredient does not mean every pen, dose, and label can be swapped. Bring the pen box, pharmacy label, or medication list to visits. The list should show brand name, ingredient, dose, weekly schedule, start date, and reason. That habit prevents double treatment. Do not stack paired names by accident. Stacking means taking overlapping medicines together without a clear plan. A person should not treat Ozempic plus Wegovy as unrelated drugs. The same warning applies to Mounjaro plus Zepbound. After the plan is clear, remember pairs. Ozempic and Wegovy are Semaglutide. Mounjaro and Zepbound are Tirzepatide. Ozempic and Mounjaro point to diabetes. Wegovy and Zepbound point to weight management, while Zepbound can also point to sleep apnea with obesity. The name is the doorway, not the treatment plan. Do not judge by popularity, price rumors, or newer sounding names. Judge the ingredient, reason, dose plan, safety plan, and follow-up. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.